I think we're getting much clearer now about what's required.
Mm-hmm.
I think we know that we need to tackle this issue of stigma. We need to help people understand that it's no point judging someone who's got an addiction, whether it's alcohol and drugs or whatever it is. Stop judging them and understand that there's legitimate causes that sit in behind the addiction, and that we need to be helping people address those causes. We also need to understand with addiction, and it doesn't matter what addiction it is, it's a chronic relapsing condition. So people will go through a period where they're actually not being impacted by their addiction, and then they'll go through a period where they are. And so we just need to accept that. That's just what happens here.
Boom. Welcome, everyone. Another episode of Real Drug Talk. And today we've got a very special guest, someone that's actually become, I don't know if he knows it, I don't know if I told you this, but he's kind of become a bit of a mentor to me in, some workspaces that I'm starting to find myself in. So I'm excited to bring some of his knowledge and experience to the podcast. We've got John Rogerson with us today. How are you, mate?
I'm very good.
That's good.
I'm great.
That's good. So quickly, we're going to take a new approach just to warm people up and get them into the conversation a little bit more. What'd you do today? Just give us the small talk.
So today, so I'm setting up a sled in my workshop to take old reclaimed hardwood and take the top off it and expose the natural hardwood grain. So I've been down to Bunnings, bought a couple of pieces of timber, went to the bloke next door and knocked a bit of timber off from him, and I'm just halfway through building the sled.
Nice. What's the sled for? Like the snow or what?
No. So this is for reclaiming old hardwood, mate. So I've got two sons who are builders.
Right.
And pulling down old parts of houses, and this beautiful timber gets thrown away.
Yeah.
And so I've been able to make some grazing boards and a range of other things, and I'm just going to make a couple of bedside tabletops and all that sort of stuff. So it's beautiful, beautiful old wood, and I love playing with it.
There you go. You can tell I'm as handy as a foot, asking you to go on in the snow with a sled.
Look, Jack, you brag for Richmond, mate, so that's all that counts.
That's right. People have heard enough of my Richmond escapades on this show. So one of the things I was saying to John off air that, we're really passionate about doing with this show is that we kind of want to bring all elements of the AED space to people that are interested in this sector. And one of the things that doesn't get talked about much, I don't think, is professionals working in the space, or experts, for a lack of a better word, or people that are working in the system, or people that are researchers or have worked with government, all these sorts of things that we don't hear much about. It's actually really important to how everything turns out and how the system runs. We want to bring some of those people to the forefront and give them a long form conversation to actually contextualize and talk about the issues in the sector as well, because I definitely felt like that for a long time. And a lot of people say to me, the system's fucked, which, me and John largely, hope I'm not talking out of school here, think that as well. But it is interesting when you start to talk about kind of the nuances behind it all and the reason it is why it is. So do you want to tell us a little bit, John, how did you, what's a bit of your background? How did you get involved in the alcohol and other drug sector?
So it's a bit of a long story. When I went to uni, I did agricultural science. So
yeah.
I ended up with an ag science degree. And whilst I was at uni, I got a cadetship. These are things they used to do in the old days where they'd actually pay you to go to uni.
That's amazing.
So I was paid by the Department of Agriculture. And so when and the reason for that was hardly anybody wanted to do ag science.
Yeah.
So I ended up graduating, and they gave me a job.
Yeah.
So I had a choice between working with poultry or working with pigs, and I chose to work with pigs. So I worked in the pig industry for 10 years.
Wow.
So really just advising pig farmers how to raise pigs, really well and profitably. And I loved it. I loved traveling around Victoria, meeting with farmers. And the first thing I learnt was you can never tell a farmer what to do because they know more than you. They actually got to work together.
Yeah.
And it was that learning that actually helped me when I got into the alcohol and drug field. But I loved doing that work. And then I worked as head of the Department of Ag's Public Affairs Unit for 4 years. And then I managed a commercial business for them for another 3. And then I was done. I'd had enough of the public service. And so I applied for a job at the Australian Drug Foundation, what it was called then. Now it's the Alcohol and Drug Foundation. But I applied for a job with them and got a gig with them.
Yeah. There you go. So did you, like, what interested you to go into, you know, from pigs into alcohol and drugs?
So both my parents are big helpers.
Yeah.
And particularly their focus, you know, is around the church.
Yeah.
So I picked up some of that, you know, this thing where you actually try and forget yourself and actually do stuff for other people.
Yeah.
So there was something about that that's always been with me. And I guess it was a bit serendipitous, but this job came up, I applied for it and got the gig. And I spent, I don't know, 23 or 24 years there and loved every moment of it. Because it's an environment about working with people, about what's important to them, trying to get yourself stepping back from that so it becomes all about them, but actually you can work with lots of people to make change. And that's what I loved about the job. We're able to get some stuff done, even though, as you've already alluded to, the system around alcohol and drugs in Australia is not a good system. It doesn't work well. And we'll talk some more about that as we go through, I'm sure.
Yeah. So I think the interesting thing about your career path in the alcohol and drug space is actually a little bit different and probably something that doesn't get talked about a lot, which is prevention. You know, predominantly, I believe, still to this day, I think the Alcohol and Drug Foundation sort of focuses on, or it's a big part of what they do. So was that solely what you guys did when you were there? Was it around prevention or community engagement? Like what were you actually doing? Because I think it is a little bit of a different space to what we might talk about on this show a lot, which is treatment and things like that.
Well, it was particularly focused around prevention, but at the end of the day, it was trying to make a difference. And you can't have prevention, treatment, and all those other parts of the field operating independently. You have to work together.
Yeah.
But what the Alcohol and Drug Foundation did, and I'll give you a little bit of the story around the Good Sports program, because I think it's interesting in terms of prevention, is that the police came to the ADF in 1996 and said, guys, we've got a problem in community sport because we've got a whole bunch of males drinking huge amounts of alcohol and they're causing enormous problems in the community, particularly around drink driving.
Yeah.
So we did a piece of research which showed that that we surveyed 630 people who attended sporting clubs around, and we surveyed them around how much they drank. And 7% of the whole sample drank 13 or more standard drinks every time they were at the club.
Wow.
A third of that sample did that 3 or 4 times a week, and 83% drove home as the driver of a car. So, wow. And then for young people between the ages of 18 and 20, there was 13% drank that amount of alcohol. So massive issues around drink driving. But we also knew that a lot of sporting clubs were male bastions, and because a lot of males got drunk, they pushed the kids, the families, the women out of the clubs. So we knew that that was really unhealthy, and connecting in communities is so crucial to dealing with a whole range of social and economic issues. And so blokes were having a real negative impact. So we then put together a program to try and address it, and it wasn't complicated. It was helping volunteers understand what the law was, put in some practice that culture, and then write a policy. Policy was always last, not first. And we had amazing success. And the principal reason is that we were able to help volunteers be empowered so they could actually do something in their communities. It wasn't about us, it was actually about them. And I think that's where sometimes we get lost in the alcohol and drug field. Too much stuff becomes about us and our egos and not about the people we're trying to help.
100%. So that's really interesting. I was actually talking to my mum's husband the other day about this. You know, he's always been around cricket clubs and stuff like that, and he was actually saying to me, he said, you know, it's still obviously a big problem in society, but in terms of like sport and going to the pub and stuff like that, a lot more people used to drink drive than actually they do now. Or maybe it was more sort of culturally acceptable, you know, and he was sort of saying that he felt like that's actually been something that he's seen in the last 15 years, been a really big shift, is that, you know, people still do it. Too many people still do it, but it's been a big shift, and it's not like a culturally accepted thing anymore. And yeah, just the way that alcohol served at, you know, his cricket club and all that sort of stuff has drastically changed.
Well,
Yeah.
so part of the reason for that was just helping people understand what the law says. So if you've got a liquor license, there's a whole lot of things you have to do to comply with the law, and if you don't,
Yeah.
you leave
You're
yourself
liable.
and your committee liable.
Yeah.
So, for example, you can't sue people who have consumed too much alcohol.
Yeah.
You know, and so with Good Sports, we knew we had something that might work when we approached 25 people to do a pilot of the program. Every one of the 25 clubs said they wanted to be involved, and we were stunned.
Yeah.
But of course, one of the requirements around Good Sports is you've got to have a safe transport strategy. And
Right.
so that's not about banging people on the head. That's just saying, if we think someone's had too much to drink, then we're going to get them home safely, even though they might leave their car at the club. And we'll get them back the next day to pick up their car. But it's all about trying to care for the people in your club. And it's not about making a fuss or turning on them because they had too much to drink. Just get them home, look after them, care for them, and then sort out the issues the next day.
Yeah.
So it's like so many issues in the alcohol and drug field, issues around stigma, massive issues, and we're not doing well enough to deal with it. But I'm sure we'll talk about that as we go through.
Yeah. Well, did you watch the show last night that's been pumped up, coming out for a while, Addicted Australia, I think it's called, on the SBS?
So I didn't watch it last night because I had the opportunity to go to the beach yesterday.
Oh, nice.
And it was fantastic because it was great to get away from home. Like I'm sick of being at home, to be frank.
Yeah.
So I was down the beach all day yesterday. So I didn't get there in the end, but I'm definitely going to have a look at it because it's just an important issue for all of us to understand. And people who are addicted are no different to anyone else with any sort of other problem.
Yeah.
And there's reasons for it. And if we can help them deal with the reasons rather than criticise them or judge them, then we're all going to be better off.
Yeah, I think from what I saw in the first episode, you know, and spoiler alert to anyone that's going to go and watch it, but it's a 4-part series, so it's on for the next 4 weeks anyway. But they've done a really good job with the show in getting a pretty diverse group of people in terms of, you know, just displaying that, trying really hard to display the fact that, you know, alcohol and drugs, and they had a guy that was a gambler on there as well, that all addictions or substances or whatever it is, just it doesn't matter what background you're from necessarily, it can become an issue for anyone. And they did a really good job in displaying that in the show, because I think that's the hard thing about this stigma in this area, isn't it? Is that you want to tell people's stories, but you don't want to invertibly accidentally pigeonhole people by, you know, falling into the public perception that, you know, if you have an alcohol and drug issue, it's because you're just a shit, uneducated, silly kind of person that makes bad decisions or something like that, you know? So I think they did a really good job to do that. Yeah.
Look, I think, first of all, you can broaden the definition of addiction away from just alcohol and drugs.
That's right.
I think that's a really important thing because addiction affects all of us.
Yeah.
We need to stop kidding ourselves that it doesn't affect all of us. And the difficulty around alcohol and drugs is people think dealing with alcohol and drug addiction is really easy because it's against the law. So if you've got a problem with alcohol and drugs, just stop doing it and you'll fix the problem.
Yeah.
You know, it's that simple. So that's the silliness of how we understand this issue in the community. And we want to keep dealing with the symptoms of these issues, which is people's alcohol and drug use or whatever their addiction is, and start dealing with the causes. And the causes that underpin why people get addicted to various things, doesn't matter whether it's sex, drugs, tobacco, you name it, the things that sit underneath all this, the causes, are often associated with unresolved trauma or socioeconomic disadvantage. And so if we start dealing with the causes rather than just talk about the symptoms, that's the easy bit, then we're going to make much more headway as a community. But I think the really sad thing and the really great thing about this addiction series is we actually can't have an honest, open conversation in the community about addiction. We don't want to talk about people's alcohol and drug use because it's against the law, so just stop. Well, that's absolute nonsense. You know, we need to actually get through that. So I love it when people have a crack at dealing with this issue because we need a lot more open conversations in the community.
So how do we get there, John? Because something that has struck me about yourself is that you've been someone that's been, with this very complex issue. You know, as you said, it's not just a health issue, which it should be considered. It's turned into it's used as a political issue to get votes. It's used as a way to kind of dramatize stories in TV and media and movies and stuff like that. You know, it's become this whole thing, and it means a lot of different things for different people. So it's very charged when you go to talk to people about it. But the thing that struck me about you is that you've been someone that's been able to go to governments and get some headway, you know, things like the Good Sports program and you know, broker some kind of change in the space. Like when you get to those levels of government, like what's holding us back? What do we need to do to actually break through and change it from your perspective?
So the lucky thing for me, or the lucky thing for the Alcohol and Drug Foundation in a way, was there weren't many other competitors around doing prevention. And we got onto a program that worked. And not only did it work, but we could prove it worked. So we had a randomised controlled trial. And so that showed that the risky drinking in sports clubs reduced by well over a third.
Yep.
And not only that, the risky drinking held when people left the club. So very significant research showing that it worked. Now, the difficulty with the alcohol and drug field is we actually don't work all that well together.
Yeah.
And partly that's because governments love making division because they make everything around competitive tendering. So everyone wants money. The particularly treatment sector in this country is chronically underfunded. And to pick up the point you made just a bit earlier, which there's no votes in alcohol and drugs. You know, no politician worries about it because there's no votes in it. Yeah, that in itself is a terrible thing. So the reason I want to engage in it, I actually want to make things better, but it's damn hard work because the politicians don't see it as a sexy issue. And so I think one of the things that has to happen much more is we get a lot more data around what's going on in the field and actually put it in the faces of politicians and the media and show them what's really going on, what the waiting lists are for treatment. And we need to collect a whole lot of data. Now, the treatment field's got more access to data than anyone, but we never see it. So the treatment sector needs to work much more together. And if governments don't get it, then let's collect the data and put it out there and show people what's really going on. But there's this sort of cone of silence that happens, and we've got to do much better at getting through that. And look, at the end of the day, there's too much emphasis on research. We know the stuff that works. We know all the things that work. Let's just get it nailed and get it done so we can actually help people. And for me, that's what this is all about, is trying to make things easier for people who are really, really struggling for all sorts of reasons.
Yeah.
And of course, COVID's made this worse because one of the things that helps people is just having employment. It's interesting when you look at it. One of the first things they did when COVID struck is they solved the homeless problem. They actually got people into homes, and that had nothing to do with helping people who are homeless. That had everything to do with us people who are actually already got homes, but we don't want to be infected by this disease.
Yeah.
So what happens to all those people now? They're going to get turfed out of all these hotels and motels sometime next year. So, you know, it's interesting. We can solve problems if we want to, but this particular alcohol and drug problem hasn't had traction for a long period of time. And it's frustrating, Jack. And I know you get frustrated. And the other thing that we're not very good at is taking any notice of those people that have got lived experience. You know, and again, you come back to this issue with stigma. And so if you've had an alcohol and drug problem, what have you got to teach us? Well, those people have got a huge amount to teach us. The problem is we don't listen to those people. So, sorry, I'm on my high horse now.
We like it. So I think there's a lot in there, but one of the things that you said that's really interesting that it'd be good to get you to explain to people is that competitive tendering process, and just break it down really simply so that people, I guess, understand how funds from the government get distributed to services. Because that's one thing that people always ask me, you know, when I say, well, what, you know, people don't cooperate in the treatment sector with each other to kind of make things happen. And, you know, people ask, well, why? You know, and it's not just the competitive tendering, but that's a big part of it, isn't it?
Yeah. And look, I've been the Alcohol and Drug Foundation have been incredibly lucky that we haven't been involved in a lot of competitive tendering. Yeah. Because there hasn't been a lot of competitors.
Yeah.
But I've seen it play out right across the field, and it just creates enormous grief. Now, I don't know whether to share this with you or not, but I will. After we got the funding for Good Sports, we came through the ice epidemic.
Yeah.
And so government responded, and I think responded really well. The report that was produced by I've forgotten his first name, but Lay, who was the ex-police.
Oh, Ken Lay, is it? Yeah.
Thank you. You know, Ken, his report was a fantastic report. And so I got a call one day from a public servant who said, the government's going to make an announcement about funding around ice. We want to do some prevention stuff. What do you got? So I said, well, we're currently doing this work for the Victorian government. Mary Wilders has given us some funding to work around illicit drugs in sporting clubs. And I said, you know, they've given us $500,000 for that. So to take that around Australia, it costs probably $5.5 million.
Yeah.
And they said, well, what else you got? And I said, well, we're doing this work for the New South Wales government on community drug action teams. Yeah. And I said, well, they give us about $1 million a year. So to do that properly over 3 years, probably going to need about 20 mil. So anyway, so the guy said to me, he said, so can you give us 2 3-page submissions on each of those ideas?
Yeah.
We produced, you know, 2 3-page submissions, sent them off. This was in August. Never heard anything, but I didn't expect to hear anything.
Yeah.
I get a phone call from the minister in December, and she says, John, look, you know that money or that idea you had about doing something around ice and illicit drugs in community sport? We're actually going to give you the money for that. So $5.5 million. That was interesting. And she said, look, you had that other idea about community drug action teams across Australia, and we're actually going to give you $20 million for that.
Wow.
So we were incredibly lucky. Right place, right time. We had something to offer them to actually deal with the prevention issue.
Yeah.
Now, there was 25 million allocated for prevention, but there was 260 allocated for treatment.
That's right, yeah.
So it was really positive. And I think one of the really good things about that is, one, that funding enabled us to support communities right across Australia and support them doing the things that they thought were important. And I think this is one of the things that's been lost. We want to give community solutions that are determined centrally, and we have to get away from this. We need to empower communities to do what they think are the right things to do in their communities. That doesn't mean you do everything that way, but we have to swing this pendulum back so communities are enabled to make their own choices, and that's what that funding enabled. So whilst there was $20 million, it never really went to the ADF. We pushed it out into communities to enable them to do the work. But it just goes to show, though, how sometimes government works. And so you have to be in the right place at the right time, right time sometimes to get stuff done, and we were on those instances.
And that was what year would you say that was? That 2014 or before that, or
so you're really testing my memory. It was either late 2014 or 2015.
Yeah, and that was a time like no other for anyone listening. There was extreme media pressure, or there was just a media storm going around the ICE situation. And there was a lot of community pressure for things to change. And that's why, because like John said, otherwise things move really slowly, don't they? You know, you had that experience with getting that money for the communities and the local drug action teams and things like that. But had that ever happened like that before in your career, like where you just got money quick like that? Or was it always a slow, arduous process to put in submissions and get funding?
So there's two things about that. One is governments respond to crises.
Yeah.
And if you've got something to offer them in a crisis, then often you'll get funded. Doesn't necessarily mean you're going to get funding all the time, but often you will. That ICE issue is still a massive issue today, though. We haven't fixed that problem.
Yeah.
We've done some stuff and significant stuff to support it, but we haven't got rid of that issue. But yes, if you look back, the history of alcohol and drug use in this country, generally speaking, Liberal governments will give more than Labor governments, which is quite surprising. And secondly, where there's a crisis, governments will respond, because politically they need to respond. But that's what we sort of go through the boom bust cycle, Jack. So we're in the middle of the bust cycle. Alcohol and drugs, not politically sexy, so therefore it's really difficult to get government to deal with the issues. And the other thing that complicates it, you've got the feds doing one thing, you've got the states and territories doing something else, and this lack of ability to work together is just appalling.
Yeah.
And until we get to the point where funding is channeled into one spot and then pushed out, we are going to have all sorts of problems, because politically states will play off the feds and the feds will play off the states and territories. And that's been something that's been really disappointing for me in the whole time I've been in the field.
Yeah. And thanks for talking about it so frankly, because it is interesting. And it's something that I've come to understand is that you go in, well, I'll talk for me. I've sort of gone into this space thinking quite naively that everyone's there and they just want to do the right thing, you know. And then it's not like people go in purposely wanting to do the wrong thing, but it gets politicized, and then it gets, there's all the competitive tendering, then there's different hot button issues that come up in media that, you know, divert you away from maybe some really, you know, pressing, challenging issues. Then there's industry, you know, which I'd like to talk to you a little bit about in one particular area that comes in and you know, changes the perception and views, and has big influences on politicians and things like that to fund the things that are going to help. And then it just turns into this hot mess. So that what I was talking about there, that industry that comes in is the alcohol issue, you know.
So just before you go on to that, can I respond to that? There's two issues there. I think most people who work in the alcohol and drug field actually come from a really good place.
That's
they
right.
want to actually help and want to work with people and make things better for people who are using alcohol and drugs. But the other thing that's here, Jack, is the systemic issues. These issues, all the things that we've talked about, stigma, lack of funding, the laws around alcohol and drugs, all those issues, how we've got the states and feds and territories not playing all that well together. These are systemic issues. And unless we deal with the causes, we're still going to have all these symptoms pop up. It's no different than dealing with a person and their symptoms and causes as with this systemic issue. And that's the challenge here. But it's lost at the moment because this issue is not sexy.
Yeah, 100%.
So now you're going to start me on one of my favourite topics, talking about alcohol, the alcohol industry, their behaviour. So I mean, this is one of the issues for the alcohol and drug field is we don't play that well together, but let me tell you, the alcohol industry, when they need to play together, they play together. And they put enormous money and political power into making sure they get cut through with governments. And because we don't work that well together, this is one of the real problems for us. And so you can see, if you get organised, then you become much more powerful. If you speak with one voice, you're much more powerful. And I think governments traditionally love splintering our voice because it means that they don't have to respond to it, where it's much more difficult when you're dealing with an industry issue. Now, I spent a lot of time in Canberra. Nearly every time I went to Canberra, the alcohol industry was there. So that tells me that I was never in Canberra as much as them, I can tell you. And they were always lobbying. And you watch the lobbying that goes on at the moment. You know, they're trying to reduce alcohol tax. Now, we've got a real issue at the moment where some people's alcohol consumption's actually declined during COVID, but some people, their alcohol consumption's actually increased dramatically. So you know that if you reduce tax, it's going to increase consumption.
And that's 100% proven. 100%.
100% proven. So that's what I said to you before. The evidence is there. The research is clear.
It's actually, it's not even clear. It's like so clear it hurts your head. So, and the industry just play with it. And so if you look at the Hotels Association in Victoria, the Australian Hotels Association in Victoria, their head office is 50 metres from Parliament House, and it's got a registered bar in it. So why would that be? I just leave you with that question. Who are the biggest donors to the Liberal Party in Australia and the Labor Party as well? Hotels Association. So, you know, that's why for me, political donations should all be banned. I mean, you just look at all this rubbish going on in Victoria now with property developers and the money they make pass on to the party through, and it's just to buy favours. And we struggle buying favours in the alcohol and drug field, don't we, Jack? That's right.
So it's just really, the alcohol industry, incredibly well organised, don't give a toss about the research. All they want to do is get through and make more profit. And it's all about at the expense of people in our community.
Now, have you seen, I'm trying to find it here on the net as we're talking, I can't, but I saw it yesterday. I think actually Sober in the Country, who we had on a few weeks back, posted it. But Woolworths is, you know, because you think of all these issues in, I hate calling it this, but this is what they call it, you know, the general Australian population. If you think about how bad the issues are, but then you take this issue and then you put it in our, you know, minority communities, marginalised communities, and, you know, the Aboriginal and Torres Strait Islander communities, and it's all exacerbated, and add rural to that as well. And, you know, I saw this thing that they posted that Woolworths has just got approval, I think.
So they haven't got approval. They haven't got approval yet.
They haven't got approval.
So
what are they doing?
What's actually happened is that they sought approval to set up a Dan Murphy's, so one of these liquor barns in Northern Territory.
And it's huge or something.
Yeah, it's huge. It got knocked back by the licensing commission, liquor licensing commission up there. So now the government have changed the law so that they can fast track these sorts of approvals. So now what we're waiting on is whether the government are going to support the liquor licensing commission or overrule them. And so this is just a classic example of, if you've got money, you can drive a truck through anything to get what you want. And the poor old community, they can't get what they think is needed in their community. And it's totally wrong. And that's, you know, talking about the local drug action teams before, we need to empower communities to do the things that they think are needed in their community. So this is a classic example where big business just put up the dollars, they got all the legal support, and they drive a truck through the middle of it and get their way, and it's absolutely totally wrong.
And the thing that's particularly bad about this one, or that's got everybody a little bit outraged, like it all gets us outraged, but this one in particular, is it's in walking distance from 3 dry communities. Is that right, in the NT?
No, I don't know the details, Jack, but
I think I saw that. I think I saw that in the article that's one of the reasons it's really big, and it is within walking distance of the three dry communities, which is just a huge. It's a blatant.
And those communities have been very clear about what they want and what they don't want. But it seems to me that they're just ignored and business wins. And unfortunately, this is a regular story in Australia. So again, communities are disempowered because they don't have the resources to actually get the things they think are needed in their communities. And governments don't care. They don't listen.
Yeah.
So we're about to find out. So I'm hoping that the Northern Territory government don't do what I think they might do, but the jury's out and we'll know in a few days.
So just quickly, because I know that you know them off the top of your head, and it's something that's close to me. They're the frightening stats. What are the stats around, I think it's domestic violence around AFL and NRL grand final weekend? Do you know those ones off the top of your head? They're like really high, like the rate of domestic violence or whatever, it goes up.
Geez, you're putting the pressure on me, Jack. No, I actually don't know the stats off my top of the head, except to know that during those, grand finals and stuff, the alcohol consumption's massive, and the resultant domestic violence, there's always a significant spike.
Yeah.
And so, but none of that's surprising given the experience I've had around alcohol and sport. And we know that, particularly where there's a lot of young males involved, and it actually doesn't necessarily mean it's all young males now, of course. You do get spikes in drink driving, domestic violence, fighting, violence, and a range of other things. And it's as regular as clockwork, Jack. Put alcohol in amongst blokes, and away you go. Yeah.
And so, because the point I'm trying to make here is that's why, because when we say this thing, a lot of people just, think we're the fucking fun police trying to tell people not to have a drink or whatever. And it's not actually about that. Yes, there's those first order consequences directly affects people's health 100%, and that's part of it as well. But the thing I see with the alcohol and now gambling industry and all that is the second order kind of flow on consequences that has everybody so up in arms, and then the cost to the health system and the justice system and everything that kind of comes along with that. And then when you weigh it all up and you see it all, you go, how can this continue the way it is without any change? So just for people listening to give us an idea, because I know you're someone that has tried to advocate for this with governments, how do you go about trying to make some noise around this? And, when the odds are kind of stacked against you, like what's the process to actually lobby your government and say, hey, this needs to change?
It's a very interesting question. You got to be committed for the long haul. You've got to try a whole range of different things. First of all, there's no point dealing with anyone other than the minister and the minister's advisors. So you've got to have a good relationship with them, and a relationship that's trustworthy. And you need to work with them. You need to understand the issues for them, but you also need to build your case around what the particular issue is. There's no point just going in there with an opinion. You need to go in there with a story that's backed up by evidence, data, valuations, whatever, and show them what needs to happen and what's beneficial and what the end result is probably going to be. And you need to be in there for the long haul. It took the ADF 10 years to get funding from the federal government after Good Sport started. So, but if you're trying to change things, particularly around policy that's going to have a significant impact around alcohol and drugs, then you've got to be united with the rest of the field. You've got to speak with one voice. And I think that's one of the challenges for the field at the moment, is that we need to do much better at that. Yeah, sorry, I don't know whether that answers your question, Jack.
No, it does. That's what I was looking for. And for people listening, because this is practical stuff that I didn't know, and this is where I believe change is going to come from, is that there's a lot of people that are probably outside the alcohol and drug space at the moment that want to do something to change it because of their own personal experiences or family or whatever, and just don't know how to go about it. You know, it's the thing that always makes me laugh. It's kind of, we have a political system that's meant to be representative of what the people want, but it just seems that it's so hard to actually get access to the people to put your views and stuff across. So for anyone listening, you'll have a local MP in your local area, wherever it is, and you can actually just go to their office and talk to them. You know, that's what it's meant to be there for, and that's kind of where it can start as well. You know, so I just encourage anyone listening, because we are getting questions about this. Well, how do I actually get involved? How do I do something? Is try and unite with the local services in your area and come as one voice, as John's saying, and then go and see your local MP and go and talk to people. That's the only way it gets done. Yeah.
And look, unfortunately, one of the difficulties in the alcohol and drug field, we've had a number of examples where young people have sadly died and their family have set up a foundation, and you know exactly why that is. They want to honour the person that's died, and but the difficulty is that then becomes another alcohol and drug organisation that's out there, Jack.
That's right.
And so instead of getting less organisations to make a point, there becomes more, and it becomes even more fractured.
That's right.
That's one of the real challenges around getting us all to work together.
100%.
And of course, none of that's easy. It takes time. But unless we do, governments just drive a truck through it, because some person will say one thing and another person will say something that'll be slightly different. So they just say, oh yeah, no one agrees, so we'll just leave it.
I couldn't agree more. I think that's the number one fundamental barrier at the moment, is we don't necessarily need more organisations. We need more uniters to get everyone agree, so that we can be one voice.
And unfortunately, if you've got a big ego, this is not going to work. Because if it's always going to come back to the point that it's about you, then it'll always be about you and not about the cause. And if it's about the cause, then you'll work together.
Yeah.
But somehow or other, we need to be able to massage the egos so that we're actually on the same page. And that's often very hard, and it becomes even harder when there's money involved.
100%.
Yeah.
So they're the problems. What do you, from someone that's in the thick of it, what do you see as some exciting stuff? You know, what are some of the good things that are happening in the space?
So I think there's some. I think we're getting much clearer now about what's required.
Mm-hmm.
I think we know that we need to tackle this issue of stigma. We need to help people understand that it's no point judging someone who's got an addiction, whether it's alcohol and drugs or whatever it is. Stop judging them, and understand that there's legitimate causes that sit in behind the addiction, and that we need to be helping people address those causes. We also need to understand with addiction, and it doesn't matter what addiction it is, it's a chronic relapsing condition. So people will go through a period where they're actually not being impacted by their addiction, and then they'll go through a period where they are. And so we just need to accept that. That's just what happens here. And we also need to understand that there's other factors that are attached to these addictions, like mental health issues, but whatever it is, often it's trauma or socioeconomic issues. And if we start dealing with those issues, then we're going to be able to help people live much more satisfying lives for themselves.
Yeah.
And again, it's got nothing to do with us. It's actually about other people and their addictions and how we might support them best. I think the other thing, Jack, is there's a lot more focus now around decriminalisation of drug use. We've got to work harder at getting this done. There's no point giving people a criminal record because they're in personal possession of a small amount of a drug. All that does is make it actually worse for them. And so we actually want people to live better lives, we need to support them with stuff that actually is going to help them to do it, not processes that actually make it worse. So from my perspective, all drugs should be decriminalised for personal use. But if you're going out selling drugs, then you should be slammed with everything. But if you're just using drugs for your own personal use, then we need to decriminalise that. The other thing that we need to do, and this is just a massive issue in the treatment sector, we need to fund it to the point where people, when they put their hand up and say, I want to do something about this, then we can actually act on it and help them to do something at that point. And, you know, again, treatment's been massively interrupted in COVID. Now, to be COVID safe, there's a whole lot of additional requirements, which means that
nightmare
resi rehab places can't take the number of people they used to. And all that does is push the waiting list out. So now there's been some advantages of COVID because they've used technology much more, and that's actually helped in certain situations. But it's not the panacea. It's not going to solve all the problems in the alcohol and drug field like some people think it will. And so if we could do a lot more in this space, and some of this is, you know, if we can do some prevention stuff around stigma, around sensible drug laws, around empowering communities to make decisions, such as liquor licensing, as we've spoken about, then we're actually going to have communities dealing with issues the way they think they should be dealt with, rather than being imposed by some government that hasn't taken any notice of them and has taken notice of big business. So not sure, is that where you wanted me to go, Jack? But they're my hobby horses at the moment, Jack.
100%. And I think there's some exciting things actually. There seems to be, to me anyway, more and more exciting things in all of those areas, you know, with people coming with ideas and new ways of doing things and all that kind of stuff. One of which I'm involved in no way for anyone listening, but John is. But I think it's amazing in the start of what can be some very cool stuff, which I wouldn't mind you just talking about and talking about the service particularly directly, but then, you know, some of the possibilities that can come from it. But, you know, yes, the technology isn't a panacea, but I would like to see us come into the 21st century as the AED field. So can you tell us a little bit about Hello Sunday Morning and really it's kind of been pioneering, I guess, in the technology space and a help-seeking service for people with alcohol problems.
Yeah, so I got involved in Hello Sunday Morning 2.5 years ago. So I'm on their board. But I've known Chris Rain and also Jamie Moore probably for the last 10 years.
Yeah.
So,
Are they the founders?
Yeah, so Chris is the founder and Jamie worked very closely with Chris over a long period of time. And these two guys came up with an idea that technology could actually make a difference particularly around the alcohol issue. They started a blog. It got an enormous number of people involved, and then they transformed into an app called Daybreak, and that's been going gangbusters. So it's really a space for people who have got alcohol and drug issues to get support. So they get support through coaching and a range of other things through Hello Sunday Morning, but they get a lot of support from other people who use the app. So it's been very successful. It's got a large number of users. I can't remember how many it is off the top of my head, and I should know this, so I apologise, but I think it's, you know, well over 40,000.
Yeah.
And so people, when they've got an issue, they can jump on it and get immediate support. So it's actually been quite helpful in terms of, you know, if you've got an issue and say, I need to go into treatment, and you've got to wait a few months, 6 months, heaven forbid, but sometimes it happens. There's other ways of dealing with it. Hello Sunday Morning is a great way to start there. So I think what Hello Sunday Morning and Chris and Jamie have shown is you can make a huge difference with technology. So then the question becomes, how can this technology support other parts of the alcohol and drug field? And how can other parts of the alcohol and drug field, how can their learnings help Hello Sunday Morning? So there's this issue around collaboration and working together. but it's not just around alcohol and drugs, it's around other addictions, mental health, etc. So, we are evolving to provide better services out in the community. And of course, the beautiful thing around technology is you can get right around Australia. Well, you can get right around the world. So, what Chris and Jamie have done is really provide a really solid platform into building these other services. Now, Chris resigned as or left as CEO in the middle of this year, and left a fantastic legacy. Jamie's about to go as well. So these two guys have left a magnificent legacy, and Andy Moore is the new CEO, and he's doing a great job as well. So it's a really interesting place to be for me personally, just supporting these people develop a service that's going really well, and using technology. And I'm excited about the technology piece. It isn't the be all and end all, but it's a wonderful way to support a lot more people.
100%. And I think what it's done for the sector, I think, and just for, a lot of people, there was always that, that's what I found, because I'm just interested in these innovations just across the world in lots of different stuff, electronic cars, there's lots of interesting inventions that are coming. And I've always had that kind of view of it would be amazing to see some of this stuff be implemented for good in the alcohol and drug sector. And there was always that kind of perception, I guess, from people that, oh no, you couldn't get meaningful support and help from technology. It needs to be face to face. As you said, it doesn't mean that it works for everyone, but I think that's the biggest thing that it's shown, just from its usership and people genuinely getting results from using the resources through that platform, is that you don't actually have to go away to rehab for 6 months, or you don't have to go and see someone even face to face. You might have to, but there's a good chance that you can actually just get support off your phone or through friends and family, and meaningfully change your life. And I think that's what it's proven, which is exciting to me.
Yeah, and it's incredibly exciting, and I think that's the message. You're right. If you've got an issue around alcohol and drugs, the field's got a whole range of different services they can support you with. So you need to find the service or support that suits you for whatever's going on in your life, and there usually will be something that will suit you. I think the other thing Chris and Jamie did is they actually innovated. And one of the problems with the field at the moment is we can't get enough money for traditional stuff.
100%.
Innovations. And so that's the really disappointing thing. So Chris and Jamie started they've only just got government funding. Most of the funding came from organisations like Google, from health funds, from banks. So, just a whole lot of different organisations that were looking to help other parts of the community innovate.
Yeah.
So I think that's one of the things that should happen a lot more in the alcohol and drug field, is there should be more money put into innovation, because we're just incredibly clever, us humans, and we can come up with a whole lot of stuff that's going to work much better for people. I think that's where we need to do some more work.
So lastly, I'd just like to get kind of your opinion, just launching off the back of that. What do you think about, whether it's through different funding sources or privately owned enterprises and things like that? Like, do you think that's a good thing to come into the space and maybe push a little bit of that innovation? Because there's always that kind of murky water, where you sort of go, oh, is it a good thing? Is it not a good thing to have these private enterprises come in and provide some funding or some different ways of doing things and a different lens?
I think, so I need to think about this, but I think for me personally, if the objective is to innovate and provide better alcohol and drug services to better support people that have got, their own issues in their life, then that's a really good thing. But if they're doing it because they want to make a profit from this, then I'd probably start to get a bit concerned about that. I think what we've clearly seen in the aged care sector.
Mm.
You bring businesses in that want to make a profit out of aged care, the level of care drops dramatically.
Yeah.
And my mum's in aged care at the moment. Mum's 93. She's with a not-for-profit, and they had 2 COVID cases, and they were able to manage it so there were no more COVID cases in her facility.
Mm.
Now, they did an amazing job to do that, but there's been too many terrible cases in this whole COVID thing that shows that making profit with aged care doesn't work.
Mm.
And so I'd be starting to get, now there are some instances where it can work, so let's not rule it all out, but I think there's just a level of concern that needs to be treated around people trying to run for profit businesses.
Yeah.
In the alcohol drug treatment, but we definitely need funding for innovation.
Yeah. Yeah. It's really interesting, isn't it? I think, I just, again, it's what probably Hello Sunday Morning and other organisations like it have done for me is just, it's just like kind of the sector coming to terms with maybe what we've been doing for 30 years hasn't worked as well as we wanted it to. So instead of just banging on our drums, like maybe we need to think differently about how we do things. And, you know, I think that there's some different people coming in and some different organisations that have opened up the door to that. And it makes for an exciting future, I think, in the space. And maybe I'm just drinking my own Kool-Aid and I'm a bit excited about nothing, but you know, we gotta be hopeful, don't we?
So I'll always be hopeful in human beings getting there. It's always good to have different views and different ways of doing stuff and getting new people in the field. It still creates the challenge though around how we work together.
Yeah.
And we've just got to get that done better.
Awesome. Mate, thanks for coming in and being so honest about that, because I really mean it. It is hard to say that stuff out loud, particularly, you know, if you're still working with governments and whatever, because you don't, like you said, and I believe that as well, like even politicians largely, I don't know, you might disagree with me. You know, I genuinely believe that people are trying to do the right thing to some extent and trying to make things better. And it just, then you add in all the other stuff to the mix and it kind of messes things up a little bit. So, you know, I appreciate you coming in and saying that out loud and putting it out there, because it is very interesting for people, and hopefully it inspires a couple of people listening to get involved in the public service and work on the system, because that's what I think is at an all-time high, is people's frustration and rightly so, and distrust in political systems and, you know, public systems and services all around. And if we can kind of change that to make it better for everyone, it's good. So thanks for coming in and talking about that stuff, John. It's awesome.
Well, my pleasure. There's another whole conversation we could have, Jack, around the political process, because I actually think it's busted.
Yeah.
There's too many politicians who just want the power and the status without wanting to get stuff done. And I'm interested in getting stuff done. And the problem is our egos as human beings are interesting things to have.
Yeah.
But let's save that up for another day, Jack.
Yeah.
And of course, we haven't spent any time talking about Dustin Martin. And there's one of the great footballing freaks who kicked 4 magnificent goals in the grand final, and what a performance. But we'll leave that for another day, Jack.
Well, actually, I've just been rubbing it into all my mates because I love when things are undisputed. Greatest of all time in the finals. Undisputed, he is. He's the greatest.
No, I'm not thinking that's undisputed.
That's undisputed.
Certainly undisputed in the modern era, but let me tell you, there's been some great footballers play amazing finals football.
Yes, but no one else that's won 3 best on grounds. You can't go through that. You can't go past that.
That's true, Jack, but the North Smith medal didn't start till 1979.
They still would have had best on ground though, wouldn't they?
Well, they probably would have, but then that would have been one person's view, not 6 people's view.
True.
Yeah. But
Well,
I don't want to stamp on your parade, Jack.
I was going to say it's my show, so he's the greatest of all time.
You just keep loving it, Jack. It's cool.
That's right. All right, very good. Thanks for that, mate.
Catch ya. Cheers.
Hey YouTube watcher, thanks for watching this video and I hope you enjoyed it, and I hope you and your family are doing well in these extraordinary times. I also want to ask you, can you please subscribe and hit the bell notification? We're really launching into our YouTube channel this year and want to build our audience so that we can progress through the ranks and basically get the message of recovery and hope and change and all that good stuff out there to as many people as we can. So we would love it if you would consider it and subscribe and help us out. Also, for anyone seeking help and information and resources, we've put together a 100% free online course that you can access, link in the description. So if you are looking for help, hope that is something that can help you out as well. Until next time, see you in the next video. Peace.